Let's also talk about the legal representatives of Mario Biotech who have confirmed this information, and they have said that action is being initiated. Samples have been seized on December 27th, and the manufacturing has been completely halted until they know what exactly went wrong. So shipment has also been stopped until the report comes out. So the lawyers now assuring action, saying that the deaths that have taken place are concerning and they are looking at what went wrong.
हमें भी अफसोस है, कहते हैं अब किस वजह से डेथ हुआ, अभी जो है गवर्नमेंट यहाँ इंक्वायरी कर रही है, अंडर इन्वेस्टिगेशन है। जो रिपोर्ट आएगी उसके बाद जो है रिपोर्ट आने के बाद जो है सही चीज़ें मालूम होंगी। हमारी तरफ से कोई प्रॉब्लम नहीं है। हमने
आपकी ये कब कलेक्ट किया गया है सैंपल आपका? अभी सिर्फ का सैंपल है जो रिमेनिंग।
आई थिंक 2 दिन पहले की बात होगी है। 2 दिन।
So Mayank, the advocate saying that because of the concerns that have been raised, the manufacturing has been halted completely, and this is something that the BJP has been speaking of as well, that as of now in Gambia, in the proceedings that have gone on, it is revealed that it was because of an overdose, not because of the cough syrup per se, that the deaths took place. But yet it is concerning, and there is a probe that's ongoing on that. But why politicize the issue when it is at this stage?
Well, absolutely. As far as this, death in Uzbekistan is concerned, that a joint team of the UP, drug watchdog and, central watchdog, the CDSO, had, led an inspection of the plant of Marin Biotech in Noida on the night of 27 December, and they collected samples of the concerning cough syrup, and they were sent, the samples were sent for the presence of ethylene glycol to the central.
All right, stay on with us, Mayank. We have a statement that has come in from Uzbekistan. In fact, the Uzbekistan government has made that admission that the drugs were tested and approved by the government. The tablets and the syrup Doc 1 Max were manufactured by the Indian company Mario Biotech Private Limited, and it was in our country, registered in 2012 and went on sale in the same year. According to the Agency for the Development of the Pharmaceutical Industry, each drug series was tested with a subsequent issuance of a certificate of conformity. So this drug was imported into our country by Quora Max, that also being mentioned in the statement that has been issued by the country. So Mayank, this is very, very important at a time when politics is breaking out in the country over made in India medicines, as the Congress party called it. The Uzbekistan government giving that admission that the drugs were tested and approved in the country.
Well, absolutely. If you read that statement from the Ministry of Health in Uzbekistan, that gives a clear indication of how things unfolded. So these these children were given this cough syrup for cold and flu for 2 to 7 days, and in multiple doses without any prescription from a doctor, rather on the advice of the pharmacist. That is a very dangerous sign in medical science. So and also that this company has a history of exporting medicines to Uzbekistan and also UK, and for the last decade they have been exporting, and those exports and all those medicines were already approved by the Uzbekistan medical authorities. So it is not that this was an illegal export, or that the quality of the drug was not inspected by the Uzbekistan medical authorities, and that has been given in the Uzbekistan medical report that the Ministry of Health of Uzbekistan has also given. So it remains to be seen what will be found out in the laboratory assessment of these samples that has been collected by the CDSO, but especially unfortunate politics has been played on between the Congress and the BJP over this. The Congress party is saying that that Indian-made cough syrups have started to become scary after the deaths in Gambia and now in Uzbekistan. The BJP is obviously saying
the BJP is saying that the Congress party is cherry-picking these issues, talking about this, but not talking really about the success of the Indian pharmaceuticals. Mayank, thank you so much for joining us with those details.